One of the things about breast cancer and breast reconstruction that I routinely tell my patients is that we're in one of the best times in my mind in recent memory in terms of the technology we have to help women get better outcomes. So the days of taking massive amounts of tissue or taking numerous lymph nodes and really causing women significant morbidity, we're really changing that. And we now have technologies that allow us to precisely target exactly where tissue needs to come out for a lumpectomy so that we can take less tissue and there's less of a deformity and defect for women going forward. We're able to precisely target lymph nodes that need to come out. We're able to do it in ways that cause less pain and discomfort for patients. And honestly, I think we're in such an amazing time and the technology just keeps getting better and better. I think as a surgeon, because we see the long-term effects of surgery, we are most acutely aware of trying to really give women targeted surgical treatment so that we're not causing them harm. I love telling people who come in my office, usually not about breast cancer, but something else, that they don't need surgery. And people are always surprised by that, but we don't want to do more than we have to. And I think the idea of avoiding a re-excision or not having to call women with that awful call of, oh, we found something and now we need to go back, that's one of the most difficult calls I make. So in my mind, any technology that allows us to do a better job decreasing morbidity, decreasing the number of times women have to go to the operating room, and most importantly, really minimizing the impact this cancer has on women's lives, I think is incredibly important. So I really love that now we have these wire-free options that we tell women, oh, you're having a small marker placed, it will help me, I can find the exact location for it to come out in surgery. And women are much more relaxed about it. It's a little procedure I have before my surgery, and they handle it so much better. And I think the day of surgery, I used to give everyone Valium the morning of surgery because they were so anxious about it. And it's been so lovely to see that women are calm. Everything's taken care of. We have time as surgeons to look at the imaging. We know where we're going. We know what's been targeted. And it's just a better patient experience and honestly a better surgeon experience as well. One of the trends that we've seen in breast cancer care that I personally really love is this idea that we don't want to be over-treating people. So it understandably used to be that we always want to do more. We don't want to be not doing the things that we need for preventing cancers from coming back or worrying about what that might mean for women. But honestly, what we found is that a lot of women are actually probably getting more treatment than they need, and those treatments have side effects. So one of the examples where we've really seen this is in DCIS, or what we consider stage 0 breast cancer. And what we know is that breast cancer itself is not life-threatening. So while that could become something, we want to make sure that we're not doing things that could really cause women major side effects when right now they have something that isn't life-threatening. So one of the best examples in my mind from a surgical standpoint is the fact that we now have technology that allows us to avoid doing lymph node biopsies in women who have stage 0 breast cancer, DCIS. And the reason this matters is because when we do mastectomies, we're no longer able to go back and take a couple of the lymph nodes through a sentinel technique if we find out we have surprise pathology. So what many surgeons do is actually do this lymph node biopsy during the mastectomy, even for DCIS. And most of the time when we get our pathology, we find out that women didn't have invasive cancer. So essentially they've gone through this unnecessary procedure that really does have side effects. Women can have pain, they can have some arm swelling, they can have long-term impact in terms of what it means for exercising. So being able to avoid that actually does make a huge difference and make sure we're getting women the right treatment that they need without over-treating them.